All right, guys, in this lesson, we're going to talk about vein selection. We always want to pick the best vein whenever possible. And why do we do this? Well, the first one is always going to lead to more positive patient outcomes. And this also means that you're using your critical thinking skills to figure out what's needed for your patient. So is your patient going to need blood or contrast, or are they going to need intermittent infusions? This helps you to select the right location for it. Also, some situations tend to lead themselves to being better selection locations than others. So the first thing you want to do anytime you're selecting a vein is you want to consider everything about your patient. You want to look at things like physical attributes. You want to see, is the patient lean or are they a bariatric patient? Because that will change your vein selection up a little bit. The other thing you want to look at is any past medical history. Does the patient have a higher likelihood of having maybe atherosclerotic veins where they're a little bit tougher? Are they going to be at risk for other things like kidney disease where they have an AV fistula and maybe it can't go on one side? These are the things you need to think about. The other things you need to think about are the current medical problems of the patient. Burn patients are really good examples of patients that you have to think about their anticipated needs because they're going to need fluid resuscitation. So they're going to need lots of fluids over a really short period of time. So putting a 22 in the hand is not going to be best for them. So you have to think about these things. Other things that you want to think about are they currently trauma patients? Do they have a lot of significant edema? Because that's going to change the location of the IV. So now let's talk about locations. First, we'll talk about the upper extremities. So the first location is the hand. There's lots of great veins in the hand, but there are certain things that you have to remember. Only certain gauges can go in the hands, and they're also extremely painful. Try to avoid them if you can, but a lot of the times, if you're like in the emergency department and it's the only option you have, then it's the only option you have. One thing to remember when you do start IVs in the hands, you never want the lumen or the end of the catheter to end in the wrist. A lot of times, there's a lot of bending in the wrist, and that's going to occlude the catheter, and it's going to give you problems all day or night, and it may actually compromise the integrity of the catheter. Now we're going to move on to the forearms and the arms. There are two prime locations that we look for. We look for the cephalic vein. The cephalic vein is going to be your friend in almost all of your locations because the cephalic vein actually begins here at the wrist and goes all the way up to the shoulder. So you'll follow that and we'll talk about it more in a second. But the cephalic vein is going to be most of the time it's a big garden hose and it's your first location, especially if your patients are fit and if they don't have any real complications. The next veins you want to consider are the basilic veins. They actually run on the underside of the arm. That's another good location. It's also a hidden secret. So I actually had one patient one time who unfortunately was a previous IV drug user, and she knew that the only vein that she could hit was the basilic vein on this side, and sure enough, I didn't have to stick her more than twice because I actually got it there. So that's one thing to keep in mind. Now the next vein that we're going to talk about is the elbow, which we call the AC, which is the antecubital fossa, which actually starts here. Remember that cephalic vein goes here and it ends up right here, so that's another good location. It's really frequently used in the emergency department because it's usually a big vein, it's usually readily accessible, there's not a lot of trauma or problems that happen here, and a lot of patients are easily cannulated there. One thing you want to keep in mind is if your patient is younger or if they have a tendency to be non-compliant, they could wiggle or move their arms, and that's also going to occlude that vein, and it's going to cause a lot of problems for you. So just remind your patients, hey, be still, don't bend your elbow, because if not, you're going to have your alarms going off all night. The next vein we're going to talk about is a continuation of that cephalic, which goes up the bicep and into the shoulder. In bariatric patients, I've often put them in the shoulder, so that's one thing that you consider. But it's usually higher, and if it blows, you're not going to have a good opportunity to be able to put another catheter in somewhere else down here. Now let's move on to the lower extremities. Now, I'm going to caution you. Best practice is that you do not put IVs in feet. However, I will say that in a practical application, sometimes it is your only option. And if your patient's option is to get an IV in the foot, or they're going to have some irreparable harm, I'm always going to put the IV in the foot because my patient's safety is my first concern. So just use it in caution, especially with your diabetic patients or patients that have some sort of neuropathy in their feet where they can't feel, because that puts them at a higher likelihood of having some sort of risk. The other thing that you want to consider with the feet is that they are also painful. So tops of hands and tops of feet. There's something called the dorsal venous plexus, which runs on the top of the foot, and there's a lot of wiggly veins, so sometimes they're a little bit more complicated. The next vein I want to talk about is the greater saphenous vein. It's actually a continuation of that dorsal venous plexus that runs from the foot up into the lower leg. It's actually on the tibia side. It's usually a great vein. But just like with your diabetic neuropathic patients, sometimes they lose some of that sensation. So just be aware that when you're using lower extremities, sometimes they come with a little bit of risk. So let's talk about the do's and don'ts of vein selection. You do want to do these three things. First, you want to pick a vein that's straight. That's going to give you fewer complications. The other thing you want to do is pick a vein that is non-branching. If you pick a vein that's non-branching, you're going to have less likelihood of hitting valves and it's going to be easier to set. And the third thing is you want to pick a vein that's most distal. Remember, starting up here in the shoulder, even in a bariatric patient, may not lend itself to be a better option. So the lower you can start, the better. So what do we not want to do? Well, the first thing that we don't want to do is we don't want to put a peripheral IV on a side that has had a complete or radical mastectomy and a lymphadenectomy. That puts them at higher risk for complications. The other thing is you never want to put it on the same side that's had an AV fistula. You never want to put it on a side that has a DVT, and you never want to put it in a location that looks infected. You're just setting yourself up for complications. I hope that these tips have been really helpful in helping you select the right vein for your patient. Now, as we always say, go out and be your best selves today, and as always, happy nursing.